Now, glitches and delays and last-minute deadlines has made the process of signing up for health coverage pretty confusing for most people. Insurance agent Craig Gussin is joining us this morning to answer some of those most frequently asked questions. Good morning.
Good morning.
And happy holidays. Thank you for being with us.
My pleasure.
You were just telling me you've been awfully busy lately.
Yeah.
No surprise there.
No, not at all. I just think the biggest surprise is what you just talked about, the glitches. On Monday, literally, we could not fax in or email in applications, not email, but go online and fill out applications all day.
You know, we just had this story about the enrollment going to 2 million on Tuesday. Is that surprising to you? Does that sound like a good number to you?
Unfortunately, you can't, what the numbers really mean, we don't know, because how many people tried to get online, couldn't, and then got out and went back in. So is that 2 million really 250,000 people altogether? Because I'm telling you, in California, everything was down. Yeah. So most of the day, and who knows what those numbers mean. We'll wait a couple weeks, we'll have a better idea about it.
What happens if people I mean, I'm sure Monday, Tuesday, it's right before Christmas. The last thing people want to do is spend it online trying to do this. What happens if they miss that deadline? Well,
if they miss that deadline and you made a good effort to try and do it, because unfortunately, you'd go online, you try and put in your information, and what ends up happening is that you get locked out, which means you can't go any further, or it drops on you and you got to start all over. And a lot of people just got fed up and walked away. So if we can show that they made a good faith, I think Covered California is going to have to step up to the plate and say anybody who tried to is going to be covered January 1, because it was a mess. I can tell you, as an agent, we spent all day Monday trying to fax in applications, and I only got 2 in the whole day.
Out of how many did you try?
Probably 20.
Oh, wow.
And every agent I talked to around California had the same issue. They couldn't go online and do it. They couldn't fax in applications. They gave us another fax number. It still was busy. It was just a complete nightmare. So I think Covered California is going to have to realize that and give people some more leniency. We're hoping that they go at least to the end of this week, maybe up to the end of December.
So you're thinking another extended deadline is going to be
I'm hoping, because I've seen a lot of tweets from people, and I've seen a lot of frustrated people saying, I can't get online and do it, and people trying to do it on their own or going through an agent.
And you're an insurance agent,
yes.
And you are frustrated by this whole process. That
yes.
says a lot right there. And we have some of the frequently asked questions that you were able to give us. And the first one is what people can ask about the status on their health insurance if they did enroll.
Right. If you did enroll, what you want to do is, if you can get through to Covered California, make sure they have everything. One of the biggest things we see that people are missing is their income verification if they're getting a subsidy, because Covered California will ask for that. The other is to just make sure that you know your plan and you know what you got, because a lot of people say, oh, I got this plan, it's very inexpensive. Well, make sure you understand what the inexpensive plan really gives you in benefits.
And what is the best resource for them to do that? To call their actual insurance company or to call someone like you?
If they work with an agent, the best thing to do is call the agent to explain this to me. Because what people don't realize is they might say, okay, I picked the bronze plan, Amanda, because it was the least expensive plan. It's going to give me what I want. But what they don't realize, it's a $5,000 deductible, and that deductible includes medical and prescriptions. And if you're saying, okay, well, I never go to the doctor, well, what happens if you do, or if you get hospitalized? So that's a real big concern, especially for people who are maybe expecting to have a hospitalization next couple months. Maybe you're going to have a baby. And if you're going to have a baby in January, one of the things that we're recommending is that you go and you contact the hospital and the doctors now and say, look, I'm getting a new plan through Covered California. Here's my insurance company's name. Here's a plan I have. Let's be proactive, because I think if you're proactive, you're going to get a better idea, so that, because insurance companies won't know that much. The hospitals are going to say the first thing you do when you walk into a hospital or doctor's office is, Amanda, can we have a copy of your health insurance card?
Right.
If you don't have one, what do you do? So that's one of the things that we're helping people with.
What if somebody figures out or realizes they've signed up for the wrong plan and they want to change their coverage? Is that going to be difficult, or they're just going to go through their provider and that might be a more easy process than actually signing up for coverage itself?
What I told a lot of people was, let's sign up for something that makes sense to you. And you think about it. If it isn't, we have January, February, and March to change your plan. So figure out what you want. And also, going into that, what most people don't realize is, let's say they pick a Blue Cross plan. Well, that means you can only see some sharp doctors and UCSD. No scripts. So you may say, well, my doctors are at scripts, and I didn't realize that. So those are the things that we're trying to address, because Blue Shield doesn't address SHARP or UCSD.
You know, one of the next questions you had here was, how do people start on their new plans?
So what you want to do is you just want to get an idea, okay, what is my plan, and start to learn it. What's my copays? What's my deductible? What does it cover? Because everything's changing. Once you hit your maximum out of pocket, which is normally $6,350, they pay 100% of everything. No doctor visits, no prescriptions, no nothing. So start to just learn what the differences are in the different plans that they have now and how it differs from before, especially your doctor network and your hospital network.
You know, now that health insurance is required, are you dealing with a lot of people that have not been covered before and really don't understand the plans and the system? I mean, it's confusing for someone who's had health insurance for years. And for you as well.
It's confusing to me. So what we do is walk them through it and just say, okay, here's how it works, here's what it's going to cost you. One of the biggest questions is, well, my premium is $400 a month, but I'm only paying $100 of that. How does that work? And I say, well, you're going to get a bill for $100. The government's going to pay the other $300. However, Amanda, if you get a pay raise during the year and all of a sudden you're making more money, then your subsidy is going to be less. So what you want to do is check what your pay stub is and what your taxable income was every couple months. And if it's higher than you told Cover California, you need to notify either your agent or Cover California, because if not, you're going to have a big surprise when you file your 2014 tax return, which is that you're going to owe back that subsidy money.
Yeah, let's talk about subsidies.
Okay.
That was the next frequently asked question.
It is. So with the subsidy, you're saying, okay, so this premium's $400 a month, I'm paying $100 of it. How does that work? Well, you're going to get a bill for $100, and you're going to pay that. The insurance company is going to get the rest of the money from the government, and they're going to pay that. But the big concern is that you need to make sure that what your subsidy amount that you're getting really verifies with your income. Because if you said you were making $3,000 a month and all of a sudden you get a pay raise and maybe you're making $4,000 a month, well, you're not going to qualify for a subsidy, and that $200-300 a month that you were getting in subsidy is going to be a notice from the IRS sometime next year saying for 2014 you owe us all this money back.
So we are running out of time, but just to make it clear, for right now, we haven't heard of any other extended deadlines yet. You're expecting them, but you said, if you haven't signed up, basically you have now until March 31st is the next deadline? Okay.
So if you sign up before January 15th, you'll be covered February 15th. The last time to sign up is March 30th, and you'll be covered May 1.
All right, Craig.
Unless they extend it, and who knows?
Who knows? We will see.
We will.
Craig Gussin, thank you so much for being with us. Have a wonderful rest of your holiday season.
Thank you.